Hello, hello, hello. Welcome, welcome. Thanks for joining me. I am here live. I'm Dr. Dawn, Chicago's own board certified OBGYN. I am speaking to you on Instagram and Facebook. I am multitasking, which we all tend to do at times. But again, I'm Dr. Dawn. I'm Chicago's own board certified OBGYN. My mission and my goal is to empower women with pertinent medical knowledge and reproductive health information so that they can be empowered to live their best life. Right now, I'm in a phase where I'm really trying to focus on my teen girls. That is who really is I'm focused on now because this has just been a natural progression. I am an OB hospitalist. So what I do is I take care of young girls. Hey, Dr. Neela, thanks for joining. I take care of women that come to the hospital and need immediate care. So I'm kind of like an ER doctor for pregnant women when they come to the hospital. Some of those ladies are unassigned. Hey, Women Unshaken, thanks for joining me. Some of those women are unassigned. Some of those women have doctors that are on staff. So I'm the first person that these women will see, and I help to kind of determine what's going on. Then maybe they're in labor, or maybe they're just having pelvic pain, or maybe they have appendicitis. Whatever it is, I'm the first person there to figure it out and then relay what I know to the doctors that are there with me. If those patients don't have a doctor where I'm located, and right now I work in Urbana, then I take care of those patients. My job is also unique because I partner with the high-risk physicians. And so I am also taking care of all the high-risk patients, pregnant women that are in the hospital. So I like the job because it helps me to really stay on top of my OB and taking care of those high-risk ladies. And then I still get to take care of not so high risk if there are ladies that present themselves that don't have a physician. But my topic today is really coming out of someone coming to me and they're like, oh my goodness, my daughter just had a menstrual cycle. I don't know what to do. What's the next step? And this is something that has happened to me with friends, family, even patients numerous times. The very first time it happened is when I had my own practice. My practice was outside of Chicago. I had a patient that I was working with because she had fibroids. So we were working with each other with the fibroids. And she came in one day and she said, oh my God, my daughter, she just had a cycle. I don't know what to do. Can you talk to her for me? And I was like, sure. And she got up. She went to the waiting room. She brought our daughter in and she left. She's just like, okay, you talk to her. I don't know what to say. I don't know what to do. So just talk to her. So the young lady girl was in my office and her eyes are big and she's just like, what's going on? I don't know. And so what I find is that the moms are anxious, the daughters are anxious. All of us are kind of in a tizzy because of something that I see is very natural. Having a menstrual cycle is the natural progression of young girls. And so my goal is to partner with the mom or the auntie or the dad to help us show our young girls that this is natural. This is not something you should be afraid of. This is something that is one of the things that your body does without you having to worry about it. I like to stress that the body is an amazing tool. It does all these hundreds of functions that we don't even have to think about. We don't have to think about breathing. We don't have to think about, listening and how that occurs. We don't have to send out the impulses from our brain to help us to understand what's being said to us. Our body naturally does it. And so this is just another example of our body naturally taking care of something that needs to occur. So again, my goal here with this video is to create something that maybe you can sit down with your daughter or with your niece and kind of show it, because I'll be talking about what's the menstrual cycle, what you can expect, and how we can go on forward with that. And then also, if you're a mom and you're concerned that the cycle is irregular, it's something that we can kind of interact with each other and talk about. So if you're here live and you have a question, just drop your question for me in the comment and I'll be able to answer you as long as I can see it. So My approach when I talk to young girls about their menstrual cycle is to give them the facts and have it come from a positive place. A lot of times when we are discussing the menstrual cycle with our daughters or with our young girls, we're doing it from a place of fear. And I think it's because we kind of know, looking down the line, what this can mean. She's a woman, she has a menstrual cycle, so she can get pregnant if she's sexually active. And I think part of it is that we have to adjust to seeing this young girl as a young woman, which is what this menstrual cycle is the first step towards. So part of it is us trying to deal with the fact that we have a young girl that is now becoming a young woman. But I think it's important that we have it from a perspective of being happy for this young girl. Have it be a great experience. You are now part of the ranks of a woman, and you can share in a lot of the experiences that we as women have. You have to be responsible with it, but it's a great experience, and we need to let our girls not be afraid of it and let them embrace it, because that's a way that they're embracing themselves. So what exactly is happening with the menstrual cycle? We know that the difference between men and women structurally is how we're made. And when we're embryos, early in that process of being pregnant, there are hormones that are present in the body at different concentrations or different levels that help steer a embryo into being a girl versus a boy. So with boys, we know that they are more responsive to testosterone. And for girls, we know that they're more responsive to estrogen and progesterone. So as a girl or a boy, your body decides, that's my dog, Apollo, please ignore him. Uh, your body responds to those hormones, and as a result, you're born a girl. If you are born a girl, you're also born with millions of ovum or small eggs that are located in the ovaries. And as you get older, some of those eggs will kind of die off on their own without us doing anything. So by the time you get to the point where you are a young girl about to have her menstrual cycle, you have some hundreds of thousands as opposed to millions. And that just happens again on its own, one of the natural things that the body will do. So we know that when you're having a menstrual cycle, your body is responding to the estrogen and progesterone that's normally there. What specifically body parts are responding are your ovaries and your uterus. Your uterus, we know, is where the baby will be housed if you're pregnant, and your ovaries are where your eggs are housed. And so you have your uterus here, you have the arms that are fallopian tubes, you have the fimbria at the end of the fallopian tubes, and then your ovary kind of sits right in here. I'm trying to bring it in with Instagram too. So when we ovulate, the body is responding to the levels of estrogen, and it's ripening and maturing certain eggs, and so that the most mature egg is released. It grows, it's the most mature, and so it's released from that ovary, and it's picked up by the fallopian tubes. And so that ovary, then that egg just travels down that fallopian tube. What happens is sperm is usually already there. You've had intercourse, sperm is present, and so the sperm and the egg get together. There's fertilization, and then you have the process of now the egg implanting in the uterus, and the process of being pregnant is started. So if you ovulate and that egg is released and there's no sperm there, what happens is the uterus has also been responding to the hormones that are there. So the lining of the uterus, on the inside of the uterus, has thickened with blood vessels and made a kind of spongy-like material that will turn into the placenta when women actually are pregnant. But if there is no sperm there and it's just the ovum, the egg just kind of goes down. The hormones change their levels because there's no pregnancy there to cause the levels to remain high. And so everything kind of disintegrates. And that's what we see when we see the bleeding with the menstrual cycle. That's that lining that's in the uterus that has disintegrated and it's passing through the vagina. And so usually you'll have your cycle anywhere from 3 to 5 days, maybe 7. And it happens again next month. So we know that one ovary on the right side will ovulate. The next month, it'll be the next ovary. So you go back and forth, and that goes well into your 40s or 50s if you're so lucky. So that's what the menstrual cycle is. And I think it's important for us to explain to our girls what it specifically is so they understand what's happening with their body. Now, another reason that women can be a little bit anxious with their daughters starting a menstrual cycle is because they can have certain symptoms that can also occur when they have their menstrual cycle. So because of the hormone levels, you have different parts of your bodies that also can respond. So we can see things like cramping. You can see some bloating where you feel like you're retaining water. You can have breast tenderness. I have my notes because I want to make sure I write everything down. Some ladies find that they're a little more emotional, they're more irritable. All those things are a result of those hormones being at the level they are when you're on your menstrual cycle. So again, it's a process. That egg goes through, the bleeding occurs, and then you start all over again. So that's what the menstrual cycle is. My goal is to make sure that we let our young girls know what the menstrual cycle is, let them know about some of the symptoms that can occur so that when they happen, they're not unsure, they're kind of anticipating these things. And we also know that there's certain things you can do, exercise and it helps, making sure you're getting your rest. Certain foods will help you with your menstrual cycle, decreasing caffeine. We're talking about younger girls, but decreasing the amount of alcohol as you're older will help you deal with it. Sometimes we will see ladies have irregular cycles, and we may have to give them some things to help them with that. But that's another Facebook Live that we'll talk about another time. So again, that's basically what we're seeing with our menstrual cycle. And what my goal is of this Facebook Live is to help explain to the girls what's happening, some of the symptoms that's happening, so that they are understanding and we as the moms are understanding, and even the dads. I know back in the day, and even now, a lot of men kind of hands off when we talk specifically about that women's stuff. They don't want to be in the room when we're talking about menstrual cycle. They don't want to be in the room when we're talking about young girls and sex. They leave it to the moms. And I understand that because it can be a little bit, again, make people nervous when they have to think about their younger girl as somebody who can now be sexually active and get pregnant. But I do think that we are also seeing another movement that's in play where we have girl dads, and the dads are more hands-on. And I think that's important, and I'm happy to see that because we want our girls to feel comfortable about their bodies, about what's happening to them. We want them to interact with other people, boys, girls, and have relationships where they are cherished and they feel comfortable and they feel special. Men, their fathers, play a big part in having that happen. And so I think it's important for the guys to have a good understanding of what's happening, not just for their daughters, but for the women that are in their lives, so that we can have an understanding as to why potentially what's happening, why people are feeling the way they're feeling, and maybe help facilitate helping the girls and the moms feel better during that time if it's a time period that's a little hairy for them. So that's pretty much it for now. I just wanted to, again, talk about the menstrual cycle, talk about how, in my opinion, we should approach it. It's a good thing.